We'll next go to Akron. Terri Alexander is joining us from Summa Health in Akron. Terri is a nurse, been treating COVID-19 patients. Thanks for joining us. We appreciate it very much. You're kind of our cleanup hitter today. So just tell us a little bit what you're seeing in Akron, and what the situation there is in the hospital.
Well, listening along to everyone else, it's easy to see that a lot of the information is the same across the board. We're seeing definitely from the beginning till now, our population is definitely a younger population, and they're a lot sicker. It was easy to see that we had started coming into the Delta variant or a different variant just by the way the patients were behaving. We knew right away we were dealing with something different. They weren't responding to the treatments the way they used to. We got to a point where we were kind of treating them, and you knew what to expect as we went along. But with this newer variant, they're so sick, and they're sick longer, and they're younger. I mean, you could hear 1,000 of these stories a day. I sent a 25-year-old to the unit. We've got patients in their 30s, and now we're dealing with, women who are pregnant and they're in their 30s. And it's just a sad situation that we're dealing with. And I think everybody here is emotionally exhausted and just really affected personally, at work and at home. It's hard to come in with the staffing levels that we have, with the shortages of equipment that we have, and play that balancing game that we play every day with beds, with equipment. This one needs a high flow. Well, we're out of high flow. What can we do to juggle this around and move that patient here and there? It's definitely taking its toll on us after 18 months. For sure. And it's tragic. It's tragic that it's just so preventable. If we could get the community to kind of unite and vaccinate, we'd be seeing these numbers go down. We could get a deep breath and hopefully get ahead of this, which is what we want to do. I've been in nursing for 26 years, and I've never seen anything come close to this. This is definitely a completely different experience in my career.
Any message for those out there who are 20s, 30s, 40s, and
oh gosh,
who are not vaccinated yet?
Yeah, because when you're 20, 30, and 40, you feel so strong and healthy and infallible to everything else. But get the vaccine. It makes the difference. It's a tragic lesson, and I hate to call it a lesson for people to learn when they come in and they're young. 49 years old, and you're fit and healthy, and you come in and you're surprised you're on oxygen, and then you're surprised you're on that much oxygen, and now we have to start talking to you about what's our plan B. Do you want to be on the ventilator? How far should we take this with you? Those are tough choices for somebody in their 30s to make, and it's just so preventable. That's the thing that's so shocking is, it's just so preventable. Please, please, please vaccinate. We live in a culture, I think, that has never experienced coming to the hospital and being turned away. And I think people can't fathom what that's truly like until it's them or their family members that are coming in and they're being turned away. Or we have to say, we can't move this patient to the ICU. That's where they should be. But the ICU doesn't have a spot. And oftentimes those spots open up when we lose patients.
Thank you. Thank you very much for what you do. Please thank everyone else at the hospital for their hard work. It's been a long, long time. And, for those of us who are not in there, it's hard for us even to imagine how tough that is, but we appreciate it.
Oh, thank you.
Thank you very much.